The South West Local Health Integration Network covers an area stretching from the shores of Lake Erie to the tip of the Bruce Peninsula. It covers almost 22,000 square kilometers and is home to nearly 1 million people, 50,000 of whom are living with diabetes. Arnold LaSalle's of the Munsee Delaware Nation is one of them.
I remember after having diabetes for about 7 years or so, and I didn't take it serious. I thought the pills would look after it. I saw this one doctor, and he became angry with me. And he said, tell me right now what you know about diabetes. So I told him what I knew. I said, I can go blind, kidney problems, heart and stroke problems, amputations from infections. And he goes, keep going. Said, somebody that's diabetic, if they have a hard time with money, they're on assistance, they come out of abused relationships, they have addictions in the family, and their lives are in turmoil, then when you go to them and say, okay, you're diabetic, what are they going to do? Big deal. I got other problems, and the diabetes just fosters and fosters, and next thing you know, you're dead at the 40, 50 years old. But I think we need an overall type of plan where, okay, let's deal with some of the issues in your life so that the diabetes has you have a better chance of looking after your diabetes.
In partnership with health service providers, the South West LHIN is working to improve the way we treat people with chronic diseases like diabetes. In fact, it's one of the key areas for action laid out in our Integrated Health Services Plan and Health System Design Blueprint. Dr. Rob Annis explains how his patients are benefiting from the way care is organized.
It's quite clear from the literature that the best chronic disease care, and in particular diabetes care then, comes from high-functioning team-based care. In the past, it's really landed in the lap of the GP to do it all, and it's been very difficult for us. And now in Ontario, the provincial government's given us teams with family health teams and community health centres. So we have the team, now we need to be high-functioning. And that's where the LHIN, I think, is helping with two main initiatives. And one is data feedback. So for a doctor to know what's going on in his practice, how good a job he's doing, if he's doing the right things, he needs to know the numbers. I need to be able to look at the whole practice and say, yes, I'm doing a good job, or no, this needs more work. Up to this point, we've never had that opportunity, but with the Partnerships for Health initiative and the soon to come, I hope, diabetes registry, doctors are going to be given the data on their practices so that they can make changes and then see if they're working or not. So, and you really need that feedback, and I think that's one of the most exciting things that's going to help me, and is helping me now actually, to manage my panel of patients better.
We're building a healthcare system that helps people stay healthy, delivers good care to them when they are sick, and will be there for their children and their grandchildren. Find out more about our Integrated Health Services Plan and Health System Design Blueprint by visiting www.southwestlhin.on.ca. The South West LHIN, building a healthier tomorrow.